This is one of the places where people can spend a lot of time, a lot of money, and a lot of energy just going in circles. They've been told they have Candida, or yeast overgrowth, or dysbiosis, and then they treat it. They go on an anti-Candida diet, they take antifungals, they kill it, they starve it, they cleanse it, they flush it, they detox it. And maybe they feel better for a little while. Sometimes they feel worse at first because they get some kind of a die-off reaction, and they're told that means the protocol is working, of course. But then the symptoms come back. And this is where I want to slow down a little bit, because Candida is usually not the root cause of the problems that these patients have. Candida is the result of the environment that it's living in. Candida albicans is not some foreign invader that should never be in the gut. It's one of the 100 different strains of yeast that lives in the intestine. It belongs there in balance. The problem isn't that Candida exists. The problem is that the digestive and immune environment changes in a way that allows it to overgrow. And in adrenal fatigue, that environment is usually changed because the stress response system has been overactive for too long. When the body is in stress physiology, fight or flight, it suppresses the systems of rest and digest. Digestion gets suppressed, immune function gets suppressed and dysregulated. Stomach acid can be lower, digestive enzymes can be lower, blood and nerve flow to the digestive organs can be restricted. That vagus nerve isn't doing its rest and digest job the way it should. Food isn't going to be broken down as well. The mucosal lining can become irritated and worn, and the balance of the bacteria and the yeast in the gut starts to shift. That's the terrain that Candida loves. So if someone keeps treating Candida as if the yeast is the whole problem, they're missing the fact that the gut is still living under stress physiology often. The parking brake is still on. The immune system is not going to be regulated. Digestion still suppressed. The stress response system is driving the conditions that allowed the yeast to thrive in the first place. This is why killing Candida more aggressively is often the wrong direction. I've seen numerous patients come in after strong anti-Candida protocols where the killing phase generally pushes the patient too hard and they felt terrible. And that kind of a die-off reaction, it's not like a badge of honor. It's a stress on the body. It means the yeast is being killed faster than the body can clear what's being released. And in someone with adrenal problems, that can add more load to a system that's already got no room left in the bucket. We're not trying to blow up the gut. We're trying to restore balance. So yes, I do use Candida control when it's needed. But the order matters and the intensity matters. The diet matters because yeast feeds on sugar. A hypoglycemic diet, low in sugar and refined carbohydrates, makes yeast less comfortable, right? So they can't thrive, which is already part of an adrenal plan because blood sugar instability itself is a daily stress on the adrenals. So we're not doing some anti-Candida extreme type of a diet as the center of the whole treatment. We're using the same low sugar, blood sugar stabilizing diet that also takes the pressure off the adrenals. It's doing two jobs at once. So then we might replace the probiotics, meaning support with good bacteria. And good bacteria and yeast compete for real estate in the gut. Good probiotic help crowd out the yeast over time. It's gentle. And then if we're going to kill it, maybe we do it gently. Coconut oil. Coconut oil contains caprylic acid, which is a nice, mild antifungal. Mild isn't a weakness. Mild is exactly what the body can tolerate often. So we're culling the herd here. We're not necessarily eradicating the species. And that's important because Candida should not be eradicated. The goal is harmony. The goal is an intestinal environment where the yeast no longer is overgrowing because the immune system, digestion, blood sugar, stress response are all moving back towards balance. So this is why people can chase Candida forever. They treat the yeast and then it comes back. They treat it again and then it comes back. And every time it returns, they assume they didn't kill it hard enough. But maybe the problem was that they failed, not that they failed to kill the yeast. Maybe the problem was that no one changed the environment that kept inviting the yeast back. That environment primarily includes stress physiology. Not just emotional stress, although that's important, physical stress, poor sleep, blood sugar drops, food sensitivities, chronic inflammation, pushing too hard, too much stimulation, too little rest. The bucket doesn't care where the stress comes from. It all adds up. And when the bucket is full, the body stays in stress physiology. And when it's stuck there, digestion and immunity, they don't have a shot. So if Candida keeps coming back, I don't really pay attention to that and hear that as, you need a stronger cleanse. I hear that as underlying terrain that still needs work. The stress response system still needs to settle. The digestive system needs support. Blood sugar needs to be steadier. The immune system needs to come back online and in balance. Now, sometimes it also means some stomach acid support, maybe some enzymes, maybe some bone broth or collagen to help the gut lining, some probiotics, work on food allergies. But often, none of that works well unless the stress response system quiets down first. And that's the frustrating part. I get it. But it's also the useful part because it changes the target. You stop chasing the yeast as your enemy and start asking why the yeast keeps being allowed to overgrow. And usually, the answer is not hiding in the yeast. It's hiding in the physiology that it's allowing it to flourish.